Welcome back to Yahoo Finance Live. Today, well, technically yesterday, just before midnight, new rules from the CDC taking effect here in the U.S. for travelers to have to wear masks on planes, trains, buses, ferries, and taxis, rideshare vehicles, pretty much everywhere where you might have already seen them being worn, now kind of making those rules here official. And that coming as we also got updates about Russia's Sputnik 5 vaccine showing that it was more effective than some of the other candidates we've seen here in Johnson & Johnson's and Novavax's as well. For more on all of those things, I want to bring on our next guest here, Dr. Sejal Hathi, is Massachusetts General Hospital physician and clinical fellow, as well as the host of the Civic Rx podcast. And Dr. Hathi, when we look at this, obviously a lot of people were hoping that President Biden, when coming in, would make these changes. Now they're official. What do you make, though, of those in the face of some of the variants that we've seen now pop up here in the U.S.?
Well, Zach, thank you for having me on. Again, it's a pleasure to be here. And first of all, this is an excellent and an imperative first step, and one, in fact, that the CDC urged months ago when then Vice President Mike Pence blocked the effort. And the reason this is critical is that an overwhelming array of evidence attests the significant and outsized impact of masks in curbing transmission of this virus, particularly when compared with other, if equally vital interventions, such as a national testing strategy, contact tracing, accelerated vaccine distribution. And the Biden administration's two national mask orders, firstly mandating masks on all federal properties and secondly on all public transportation, are possibly the most expedient and most cost-effective measures that they might have taken. And they're as close as we will likely approach to a national mask mandate as well. But we need to go farther. And you mentioned the new variants, and they are very concerning, particularly the South African variant and the UK variant, both of which are measurably more contagious than those we've seen thus far. And because of that, we need to invest attention, resources, energy in improving not only the universality of masks, but also the quality of masks. President Biden's executive order and the subsequent rule mandates only the use of single, even cloth-based masks. But the evidence increasingly indicates that for most indoor activities, we need either a double layer, two different masks, such as a cloth mask layered over a surgical mask, or a high-quality, high-filtration mask, such as a KF94 or an N95 mask, either of which is 2 times as effective in filtering respiratory aerosols as simple or even tightly woven cloth masks. And what we've seen is that several European countries, including France and Germany, have already started mandating these higher quality masks for the general public. And with regards to mass transit,
Doctor, if I can step in here, we're talking about taking all these precautions at a time when there's also this ongoing debate about vaccine distribution itself, whether in fact, in the face of these more infectious variants, the first dose should be prioritized instead of holding vaccines for the second dose because of how effective one dose alone can be. Where do you stand on that?
So I think that it's something we definitely need to talk about and invest more research in studying. And the reason is that right now, what's most imperative is speed. What we're seeing is that these variants, and particularly the UK variant, which is expected to become the dominant strain here in the United States by next month, because these variants are so much more contagious and more easily transmissible than variants past, it might be that altering the otherwise standard vaccine rules and administering a first dose alone or focusing on that is the way to go. Now, does the evidence indicate that in normal circumstances that is the best route? I don't think so, but we might be in a different situation right now. And so I'm glad that the national discourse is pivoting in that direction.
Yeah, well, speaking of pivots, it's interesting because Politico is reporting that the Biden administration is going to be working to, roll out vaccines directly to pharmacies. It's been one critique that a lot of people have brought up, saying, "Look, why aren't you looping in some of these, locations that people are comfortable with, that they know in their communities and can see that happen?" I know maybe some of the other states that have actually seen pretty strong rollouts of vaccines so far, like West Virginia, actually went a different route and did more local pharmacies rather than some of these national chains. But when you look at that, I mean, it's clear that we have quite a few candidates now that have at least shown effectiveness adding Sputnik 5, Russia's variant or candidate to that, 91.6% effectiveness according to the phase 3 trial data we got in the Lancet. So, I mean, there's a lot of those out there. We know J&J, Novavax coming down the pike. What do you make of the plan, though, to maybe lean in on pharmacies and how that might actually help what you're talking about, just getting it out there?
Yeah, I think that it is incredibly smart. Right now, what we're seeing is that we have just a small fraction of the vaccines that have even been distributed to states that have actually been shot in arms. And so we need an all hands approach in figuring out how we can institute mobile and mass vaccination drives. And everywhere, we need to look into administering these vaccines everywhere. Pharmacies is one location, but right now we're simply not moving fast enough. And so anything that the Biden administration can do to accelerate distribution of these vaccines, including at our local pharmacies, is key. Other places we could look to are barbershops, libraries, mobile vans, even a door-to-door approach as some countries are considering. But we really need to buckle down and invest significantly in bringing these vaccines everywhere we might possibly, because right now thus far we've instituted too restrictive and slow an approach. And that's really dangerous right now when we have these other variants spreading rapidly.
Yeah, and we're seeing those spread continue to document cases here across the U.S. But appreciate you joining us here to chat all that. Dr. Sejal Hathi, Mass Gen Hospital physician and clinical fellow. Appreciate you taking the time.
Sure. Thank you for having me.